In today's Health Alert, the shortage of ADHD stimulant medications has been tough on families. Many parents, including right here in Metro Detroit, had to switch children to different medications. Our chief health editor, Dr. Partha Nandi, joining us now with a new study, a look at the Adderall shortage, Doc. So fill us in.
Yeah, it's important. So the ADHD medication shortages have been stressful for many families, and it left parents, healthcare providers, and pharmacists scrambling for alternatives, especially when school started back in September. So how did the families cope? Well, researchers studied prescription trends for kids aged 5 to 17, and they used national data that covers 92% of prescriptions in the U.S. And here's what they found after the FDA announced that the Adderall shortage in October 2022. Prescriptions for children and teens dropped significantly, but the shortage didn't cause many kids to stop treatment altogether. Instead, a switch was made to other stimulant medications, and prescriptions for medications like dexmethylphenidate, better known as Focalin, went up. So while Adderall's use went down, Focalin became a common substitute. Now, the FDA did approve more production of stimulants. Unfortunately, however, shortages continue even though Adderall does not currently appear on the FDA drugs shortage list.
So the drug finding an increase in a specific group of kids, how does that match with what's happening with
Yeah, pretty interesting, right? The study, Glenda, did find that girls aged 5 to 11 had a 9% higher rate of stimulant prescriptions than expected. Now, this matches other research showing that more girls were diagnosed with ADHD for the first time during the pandemic than in previous years. One possible reason, I believe, is that we're getting better at diagnosing ADHD in girls, which is a good thing. But it's also possible that during the pandemic, some girls had more trouble staying focused or paying attention than before, and that led to a greater need for ADHD meds to help manage those challenges. Now, there are both non-stimulant and stimulant ADHD medications, but stimulants are the most common. The CDC, in fact, says that they help about 80% of diagnosed kids. Now, these medications work by boosting the brain chemicals that help with focus and self-control, and they ease symptoms like distraction, hyperactivity, and that's why the medication shortage is such a big concern, right? Untreated ADHD can negatively impact a child's health, education, and even relationships. And while it's great that kids were able to switch to alternative medications, it's still unclear how well these alternatives will start working. And if a parent is struggling with their child and prescribing medications, please talk to your doctor about options. It's super important to stay proactive in managing your child's care because it can lead to repercussions that can last for a long time.
Wow, so important. Thank you for filling us in. Good to see you.
My pleasure, of course.
If you have a question for the good doctor, you can email him, Dr. Nandi at AskDrNandi.com, or send it to us on Facebook or X. We'll get it right to him.